Planning for higher healthcare costs in retirement. Well, your out-of-pocket expenses, as you see going from left to right, you have men 65 to men 85 plus and women 65 to women 85 plus. You see the lion's share of the dollars going to services. That's what I mentioned earlier. Services will get more expensive than the premiums because hips and knees go bad. That's really the big issue right there. The typical budget that I see for Medicare is the $144.60 that you'd have for Part B. Medigap, I use $200. That's a little high, I'll share with you. Usually it's like $158 is what I see a lot on the Medigap plans. Part D, I use $40. You can have a plan as less as $15. I've seen plans over $100, and it really depends on the meds you're on, the medications. So if I just use that as kind of a starting point, it's $385 multiplied by 12, it's $46.15. I have other out-of-pocket costs. It's about $6,200 a person. So a couple would be a little over $12,000 in Medicare costs, and you're not sick. This is simply deductibles and premiums. And this is why I like to open people's eyes to this. This is not cheap. And this is a very typical budget, okay? It's not extravagant. This is very typical. Why might even be higher? Well, higher insurance premiums. I've not seen anything go down. I have not seen anything go down. Higher out-of-pocket costs due to services. A change in health status. That's another way it can go up. Planning for future costs. Well, Fidelity has run several analyses on this, and they estimate $285,000 for a couple in retirement. And incidentally, that does not include long-term care costs. So that's just other medical costs. Other analysis have been done. Planning for long-term care, it's not covered by Medigap or Medicare. Skilled nursing care, there's no coverage after 100 days. I mentioned that. Help with activities of daily living, there's no coverage at all. 35% of people over age 65 have some type of activity limitations. Long-term care is something that the likelihood of needing it goes up as you age. It doesn't go down. So as you age, your ability to move around decreases. Your issues get higher. If you don't need help now, well, just wait. If you see that big green bar there, well, that's walking. And that's people 85 years and older. Becomes one of the biggest items because of the back, the hip, the knees. The other big one there is bathing and showering. That's another item that basically has increased in costs.